Hi friends, good afternoon. Sorry for the disturbance. Last time we could not do it because of some emergency work. So let us start a live today. We are live both on Instagram and YouTube. Caffeine joined. There may be some disturbance today because we are doing live from a different site. So before we start, few questions on the Instagram and WhatsApp which we missed on the last YouTube live or an Instagram live. So if you have those questions, you can start. What is this? Welcome, Dr. Ruhi, Dr. Mavish. Just checking the connections. So, Dr. Venkat, welcome. I hope in YouTube everybody could hear properly because there is no thumbs up on YouTube, and Instagram everybody is there online. Bedi Homeopathy. So there was one question regarding the use of pulsatilla and conjunctivitis, and of course, if pulsatilla was not there in our provings, there may be a lot of cases where we could not treat and cure conjunctivitis, cold, flu, or viral infection because pulsatilla is such an important remedy. Symptomatically speaking, pulsatilla has most of the symptoms which you can think about in cases of either conjunctivitis or in case of viral infections. For example, you can hear properly. Just a minute. There's a bit noise here. So, yes, hello, Dr. Meenal. If you go further and see pulsatilla has symptoms of I'll just discuss a case. There was a case, there was conjunctivitis in the left eye. It was very reddish on the lateral side, a very sticky and gluey discharge. Even even the eyebrows were stick, and the patient used to take out the crust from the eyebrows. There was discharge, and the patient had mild fever, and the eyelashes were also agglutinated. With other symptoms, we basically prescribed the patient pulsatilla to I think 3 doses. Within 2 days, the patient called me up and said she is much better, 80%, and she continued placebo, and she was cured within 3-4 doses of pulsatilla. So this is basically the action of pulsatilla. Of course, if you can close the door so that the voice does not come. If you see in homeopathy, pulsatilla, euphrasia, belladonna, these remedies have very good actions on the symptoms of conjunctivitis. Of course, I had a similar case of conjunctivitis where belladonna was prescribed. Whenever I prescribe belladonna, 2-3 symptoms which I take for prescription is, of course, redness is there, but the congestion of redness, the redness of belladonna is a bit different. You can see the network of capillaries in the eyes in belladonna case. First thing. Second thing, belladonna might have discharge or might not have discharge also. It could be dry also, very pricking pain, or there could be sand sensation in the eyes. The patient has to continuously rub the eyes. This is the major difference of belladonna and other remedies which I have seen in my practice, because in conjunctivitis, most of the cases comes to us in a practice where the discharge is there and the patient has yellowish discharge and agglutination is there. But in belladonna, if there is discharge, it is watery discharge, redness, congestion, sand sensation in eyes, and the redness of the eyes, which is very typical to belladonna. Before I go further, I welcome Dr. Junaid, Hahnemann, Bedi Homeopathy, always Saim Jula. I hope I am pronounced correctly. Minal, Tony, Disha, Nadia. Of course, I'm taking it after I think 1 week gap, so it feels very refreshing knowing your names and again connecting with you. So Nadia has a question: pain, leg numbness, relief only by hand rubbing and pressure till pain increases to a very high level. Waking night pain starts after dwindling. Also pain in spots, arms with touching, lightning pain. Yeah, Nadia, so if you have these cases, symptomatically, if you speak, only one remedy or two remedies that should come to your mind. But of late, you should think where you have to prescribe and on what symptom you have to prescribe. The patient says the patient is better by hard rubbing, hard rubbing, the patient is better. Pressing, and that is also, we can say, heart pressure, okay, and wakes up in the night. Also pain in the spots. So it's a case where two things are very important. First of all, you have to identify whether the patient is suffering from some nutritional deficiency or electrolyte imbalance, or it's an old age. That's why there is a spasm, and in old age there is hemoglobin is less, or the patient is suffering from some primary disorders because of which there is hardness, there is pain, there is numbness in the muscle because it is better by pressure. Most of the cases which I have seen in my practice in old age, or you can say 60 plus, lot of people come and tell me that the fathers come and tell that I do massage of my father because there is a lot of pain, and if unnecessarily waste remedies like Cuprum metallica, Macphos and other remedies, it does not work. Unless uselessly we drug the patient. So make sure for it's a nutritional deficiency, electrolyte imbalance, there is a disease process, there are a lot of other things you see. But symptomatically speaking, if you want some remedies and you have put beautiful symptom lightning like pain and all, this is a beautiful symptom of a remedy. First remedy you must think about is of course phosphorus. But if this patient comes to me, I would add one of these salts of phosphorus, that is calcarea phos. Is a very important remedy in these type of cases. It covers the symptoms of phosphorus, it covers the deficiency, it covers the muscle spasm, because if there is less of calcium, the spasm is more, and in those cases calcarea phos works beautifully. You can give calcarea phos even in biochemic 6x potency, 6x saturation, as we say biochemic medicines. In repetition also you can give, that gives a good results. Phosphorus is there, Macphos is there. One rare remedy, infrequently used remedy, I would not say rare remedy, you can think about lecithin also. Okay, and with if symptoms match, you have remedies like Cuprum metallicum, you have spasmodic remedies also. One case where the patient said that my calf is like a stone, and it was actually like a stone, could not be dealt with any medicine, could not be pressed also, and Muxol gave me good results. Muxol and Hyoscyamus, these are two remedies. One remedy you must think about in these type of cases is also calcarea floor. Calcarea floor is also very interesting, important remedy where you can think about these type of complaints. Hope you are satisfied with your question, Dr. Nadia, and meet you soon on Monday. I think we have a live, so you can always extend your question there. Okay, I hope you got the answer. Shrikant Patil, welcome. Yeah. So I was taking something about conjunctivitis, and I think we had finished which remedy? I think belladonna, and we had finished pulsatilla. Now a very important remedy, it is called as eye bright. And everybody, if you don't understand anything, it is said that think about that eye bright, that is euphrasia. Now whenever you with walking pain disappears, then you can think about one remedy, China Ars also, Dr. Nadia. And now euphrasia, the king of remedies, as we say, it has lot of symptoms. So euphrasia, if you are carrying your pen and paper, do write down symptoms of euphrasia, because this has given me very good results. In euphrasia, if it is a lady, inflammation of the eye, conjunctivitis when the menses is absent. This symptom has given me results in all cases of when the menses is absent and there is inflammation and conjunctivitis. Please write down this symptom. Or you can say inflammation of the eyes when the menses are absent. Think about euphrasia, and I would say please give euphrasia, because I am telling you, believe in me, you will get fantastic results. In euphrasia, second symptom, very important, itching of the eyes, better by rubbing, or you can say rubbing amelioration. Three remedies you must think about in this case. First is euphrasia, second is causticum, and the third is nux vomica. More important symptom of euphrasia you must write down, itching of the lower lid, especially the left. If you have itching of the lower lid, especially left, think about euphrasia. One more remedy is there which I cannot recall, but one more remedy is there which I can't recall. Third symptom of euphrasia that you must remember in case of conjunctivitis is very important. The tears are acrid in euphrasia. As you also say, tears acrid and the discharge from the nose is blend. Of course, this symptom is so very important in euphrasia. And of course, euphrasia is lacrimation with cough. Euphrasia has lacrimation in open air, it aggravates. This is a differentiating feature with pulsatilla. So these are 4-5 symptoms of euphrasia that you must never forget. And euphrasia, one symptom more is there, that is discharge. Sometimes it is pus like, pus discharge, or you can say discharge with agglutinates and pus discharge, and there is itching, that is euphrasia. Okay, so and if you want to, if your patient is complaining कि भाई मुझे आँख में चिपक जाता, there is agglutination. So in euphrasia, agglutination is more in the morning. Agglutination is more in the morning, that is euphrasia. Of course, it is present in night also. Okay, so these are symptoms of euphrasia that you must think about. So we have done euphrasia, we have done belladonna, we have done pulsatilla. There are a lot of other remedies of conjunctivitis, but my dear friends, in conjunctivitis, make sure, always tell your patient, don't touch your fingers to the eyes, because you can, if the infection is present, it touches the floor and you touch the eye, the infection spreads. So don't touch your eyes with fingers and you will not get conjunctivitis. Conjunctivitis, as patient comes and tells us, okay, my uncle, my auntie, my brother and sister has conjunctivitis, and I was looking at the eye and I also got conjunctivitis. It does not spread like this. Infection, it is spread by touch and finger. That's important. Okay. So before I go further, I have a question. Pain in shoulder up to scapula, neck, occiput about. So it is shoulder, scapula and neck. So I have told you, one mantra, Guru mantra. Whenever the patient comes to you with pain in the neck, and the patient basically comes and holds, like he comes like this holding his neck and all, you must think about one remedy which I have told you, very, very important. Anybody can give me the answer? Anybody? Which remedy I have told you that you have to think about? Dr. Abha, welcome. Dr. Anta, Dr. Samruddhi, sorry, welcome. Dr. Trish Syria, welcome. So I have told you, whenever the patient comes, like holding the neck and he has pain in the neck, shoulders and all, which remedy you must think about? Anybody? Welcome, Dr. Smita. So which remedy comes to your mind? Anybody? You must think about a remedy which it is basically not a specific prescription, but it's how you look at your mater medic. How mater medic. Like for instance, a patient today called me from he was from out of Nagpur and told me there was a lot of cough, but I slept with, I put my muffler and the cough is better. Which remedy comes to your mind? The patient tells this symptom. So this is how you have to interpret the symptom. So cramps, you must think about simesifuga, the remedy very important. Second is naxomica. Third is cicuta virosa, rustox, Goltheria, and you can think about hydrosanic acid also, which is prescribed. I have prescribed and I have got good results. Hydrosanic acid also. Okay, so I hope Dr. Rednose gone. Okay, this is your name in the YouTube, so you could write your name so that I can pronounce better. Simran. Hello, Dr. Babal, and welcome after a gap of about a week. It's only a week, but it feels that it has been so long that we have not interacted on social media. I hope the answer was sufficient. So yes, so you got something about eye complaints of euphrasia. Now somebody told me allium cepa also. No, so when we start, prescribing in eye symptom, you can have lot of remedies. Eye symptom, there are so many remedies. So can't take pillow with sleeping. Yeah, this is a very common symptom. Think about semicipho, think about naxomica, think about in fact phosphorus is also there, rustox and Goltheria are important remedies. So there were a lot of questions on conjunctivitis. So I'll just tell you something about conjunctivitis, and there was a remedy, allium cepa. Now whenever you want to prescribe allium cepa, you have to have one symptom, that is profuse lacrimation. Profuse lacrimation. And profuse lacrimation in open air, it ameliorates. I told you in euphrasia, it aggravates the symptoms. So in allium cepa, profuse lacrimation, open air, ameliorates. That is very important. Lacrimation is profuse, lacrimation in warm room, of course, because open air ameliorates. So whenever there is lacrimation in warm room, think about allium cepa, think about phosphorus. Whenever lacrimation is ameliorated in open air, think about I think it is in allium cepa, China sulph, crocus and phytolacc. Next symptom, eye symptom, there is burning, smarting, biting, pain, rubbing ameliorates. Rubbing the eye ameliorates. I just told you one remedy. Rubbing the eye ameliorates. Think about allium cepa, ammonium carb, and zincum metallicum also. In fact, in allium cepa, it is written desires to rub the eyes, and the tears are discharges blend. In euphrasia, it is corrosive. So blend discharge. Think about allium cepa. Think about pulsatilla. I hope you are understanding the differentiation of allium cepa, pulsatilla, belladonna, euphrasia. I am going fast because there were a lot of questions on WhatsApp because it did not take the live last Saturday. That's why I hope you are understanding. Yeah. So Dr. Babala is like, yeah, it feels like eternity. Yeah, it is so long. If you miss one YouTube, that's the bond we share sometimes. Though we don't meet, but basically, social media has got us so closer. One more symptom in allium cepa that you must remember, you must write down in your Mathematica notes. Dazzling, distant objects sees as if dazzling light. The vision in distant objects has a dazzling light effect. That is also allium cepa. Remember this symptom, very, very important symptom of allium cepa. So these are 3-4 symptoms of allium cepa, 3-4 symptoms of pulsatilla, euphrasia, and belladonna. I hope you understand and do write down in your Mathematica so that you don't miss any remedy of conjunctivitis in your practice. And of course, don't miss out natramur also. If anybody can tell me something about natramur, anybody? Natramur, some symptoms of natramur. Natramur, a very, very important remedy for conjunctivitis. Natramur has very, very important symptom of conjunctivitis. Anybody for natramur? Be fast, so that we can go fast. Remember, in natramur, do we have some answers? Because today we are taking a live from my new clinic. So basically there is a bit, the setting is changed, In natramur, the lacrimation is only in daytime. Remember that? Lacrimation is only in daytime. Like we have in alumina, we have in lycopodium, we have in zincum. In natramur also, lacrimation is only in the daytime. Remember this. In lacrimation, there is pain in the eye and open air ameliorates. Second symptom. Third symptom, of course, the pain is burning, smarting, biting, while reading, while writing. This is a very, very important symptom of natramur, and one symptom of natramur that everybody should remember. There is prickling in the orbits. Prickling. I had a very interesting case. The patient came and told me that Hindi, I'll tell you that मुझे ऐसा लग रहा है कि दिवाली में हम जब फुलझड़ी जलाते हैं ना तो फुलझड़ी समझ लग रहा है मेरे ऑर्बिट्स के अंदर. And that was prickling like pain in the orbits. Natramur 200 single dose cured the case. So this is fuljadi for the doctors who are outside of India. It's a type of cracker. The cracker sparks when you light it. So that was the sensation, that was the symptom that the patient told me in the eye, and Natramur 200 cured the case. This is the importance of interpretation. And in natramur, the patient comes and tells you, I cannot touch my eyeballs. I cannot see light. I cannot see this, that, XYZ, because the eyeballs in natramur are very sensitive. You must think about natramur when the patient says that prickling in the orbits and the eyeballs are very, very sensitive. This is the importance of interpretation of symptoms. That is natramur. So this is, I hope you understood some symptoms of natramur, some symptoms of euphrasia, belladonna. These are very, very important symptoms that you should remember. I hope nobody's giving me thumbs up. Nobody's taking the heart out and giving me some heart, so that I know that you are understanding what I'm trying to convey you. Because there were so many questions of conjunctivitis, that I could not tell you all the remedies. But whatever 4-5 remedies which I have used in my practice, I'm just sharing with you so that you can write in your practice, okay, prescribe in your practice. Now the discharge. Now discharge in natramur, it is said that the discharge is mucus, or it is said that the viscous discharge. Yeah, only Disha is understanding, I think, because she has only given me plus heart and no thumbs up. So I hope you are understanding, So natremure has the discharge is viscid. पेशेंट आके बोलेगा कि जब मैं डिस्चार्ज हाथ में लेता हूँ तो पूरा चिपक जाता है दैट इज द डिस्चार्ज ऑफ इट स्टिक्स much like Calibacrom, but not so stringy like Calibacrom. That is the discharge of natremure. So I hope, see, there are lots and lot of symptoms of natremure, but these are symptoms where you have to understand and prescribe natremure. One symptom of natremure is there, if the right eye is red, the discharge will be from the right eye. Means the affected eye has discharge. That's natremure, and lacrimation in natremure is with sneezing. So these are the symptoms of natremure that you should remember, and in conjunctivitis or eye complaints. Okay, Restox in conjunctivitis. Okay, just a minute. I'll just tell you. I have one more question before that. So you had once told a remedy something like Nigudium for, I forgot name. Yeah, Nigudium. Nigudium. It is from the books drugs of Hindustan. Nigudium, Indian drugs. You can check out the spelling. It is Nigudium. Neg. Yeah, so there was one question for Restox. If you have seen my Restox video on nose, I think I've covered some symptoms of eye also, but I'll just tell you, whenever you are prescribing a Restox for conjunctivitis, 2 or 3 symptoms which you have to remember in Restox are very, very important, In Restox, inflammation of the eye are from suppressed perspiration, the first symptom. In regarding conjunctivitis, it is itching in the inner canthus of left eye, pricking. Pricking is a very, very important symptom of Restox. Inflammation on becoming wet, it aggravates. Of course, this is rainy season, so that wet weather aggravation in Restox is very, very important. The problem starts when you only think of Restox. Second remedy you must think about, more important than dulcamer, is calcarea carb. My dear friends, calcarea carb, when there is wet weather inflammation of the eye, think about calcarea carb, and dulcamer is of course definitely there. Other symptoms of Restox is a very important with lacrimation in gushes. बहुत ज़्यादा lacrimation in gushes, and sometimes the eyes become so stiff the patient feels it is difficult to move the eyelids. That is a symptom of Restox. Other symptom of Restox is swelling. There is a swelling sensation of the inner canthi, especially right. One symptom I told you, tears, gushing, and tears in Restox are salty. And this symptom the patient will come and tell you, salty tears. Think about Restox, think about creosote, and think about belladonna also, salty tears. Very, very important, One remedy in Restox in regarding vision. In vision, the patient comes and tells you the vision is foggy, especially in the evening. So these are few symptoms of Restox, my dear friends, doctors, that you have to remember in prescribing in conjunctivitis. Voice. So these are the very Dr. Savita joined. Welcome. Okay. So these are the symptoms of Restox. Of course, if I start telling symptoms of Restox, the whole half an hour will be lost. So this is a symptom that you think about. Of course, in Restox is also very, very important remedy for chemosis of the lids. Chemosis. Okay. And this is something very I can say very, very superficial and very, very few symptoms of Restox eye which I have told you in conjunctivitis. Doctor, thank you. Always thank you. I'll just tell you. I hope you understand this. So again, we move fast, and if there are a few more questions I can answer. It is already 25. We have just still 5 minutes. 5 minutes is a long time. Welcome, Sultan. Can we have some more questions fast? If you have and I have forgot, you can always type again. So if you don't have, we can always start prescribing some more, adding some more symptoms of Restox eye. Whatever I can gather, recall some symptoms of Restox, you must think about. I told you hardness, the patient has felt difficult to move the eye. Photophobia, remember, write these symptoms of Restox. Photophobia after fright. I had a beautiful case, where the patient had seen an accident. That fright of the accident was so severe in his mind. He developed photophobia. He could not look at the sun, bright light, dazzling objects. Of course, I failed once, twice, because I took elements from fright. But I remembered one symptom of Rustock's photophobia after fright. Only one remedy in the whole Mater Medica, Rustock's. I gave, I think, 1 m, single dose, cured the case. Typhoid fever treatment. In typhoid fever treatment, make sure that you ask the symptom. Whatever I have cured cases of typhoid, I have asked symptoms of thirst, I have asked symptoms of modalities, I have had symptoms of thermals, very, very important. And when is the spike of the fever? More in the morning, more in the evening, more in the night, or the fever is oscillating, goes up, comes down, goes up, comes down. That. And what does the patient do during fever? The patient wants relative during fever, the patient wants to be alone during fevers, the patient wants to the whole light to be shut off during fever, the patient wants the fan during fever from the close distance or from the far distance, the patient has pain during fever, wants his mother, wants somebody to massage his extremities, the patient has headache during fever. These symptoms are very important during prescribing. When the patient comes late after 15 days, do ask symptoms of stomach, whether the patient has stools problem, diarrhea problem, how is the diarrhea, how is the stool, how is the constipation. These are the different symptoms you have to ask the patient to enter the case. Okay. Best videos 3078. Negudium. I hope you got the remedy. The remedy is present in the book Drugs of Hindustan. Phone. So I hope Rustox is done, and I hope typhoid fever is done. As we go further, still we have 2-3 minutes left, and I can see some hearts on Instagram, but no thumbs up on YouTube. So sometimes I feel whether you are understanding what I'm teaching. That's because I'm a bit fast in teaching. You must have understood my way of teaching. I'm a bit fast so that I could cover a lot of remedies. Rustox we have done, belladonna we have done. Some remedies are very, 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 very common that we understand. In these type of conditions. But there are some rare remedies also where you should think about in cases of conjunctivitis. And if you have understood, if you have, I know everybody must have read Muxol in your days of every day you must be reading. But Muxol, has very, very important symptoms of eye. If we have time and if you have no questions, I'll just tell you some symptoms of Muxol, where I have got very, very good results. It is written in Muxol, the patient feels as if my eyes are generating sparks. My eyes are generating sparks. One remedy I told you in the stocks, the orbit feels as a sparkling pain, prickling pain, but my eyes, are emitting sparks. A very important symptom of Moxol. Very, very important symptom of Moxol. One symptom. Second symptom, the patient of Moxol would tell you that there's burning pain, of course, there's smarting pain, there's biting pain. The warmth of the bed aggravates the symptom. The warmth of the bed aggravates the symptom. That is the important symptoms of Moxol. One symptom that you must write in your Mater Medica, feathers. The patient feels as if, not feathers, feathers, yeah, Feathers. Feathers came from the corners of the cornea, as if feathers are coming from the corners of cornea. Feathers. Feathers, as if they're coming from the corners or from the corners of the eye. The feathers are coming from because I had a case, he used to tell me and look like this, doctor, I feel a feather is coming from the eye. I prescribed Moxol. It was difficult on the first instant to Moxol, but ultimately on the third prescription I gave Moxol, that cured the sensation and the symptoms. Okay. Thank you. On potency, yes, I'll take a session on potency. 15-year-old came with leukorrhea since 1 year. Now, whenever you are prescribing for leukorrhea, of course, you can always say a leukorrhea in young girls and you can prescribe the remedies also, no? And you give sepia in most of the cases. But I have seen in my practice, if you go this type of, you might hit sometimes, you might hit not sometime. But understand how is the leukorrhea. It is important to understand how is the leukorrhea, and then we can go further. Otherwise, leukorrhea in young girl, we have sepia, we have Merxol, we have pulsatilla. But if it is acrid, think about cubeba. If it is yellow, think about Merck Ido flavors. It is milky, think about hypericum. So there are a lot of permutation combination. So define that leukorrhea. Otherwise, pulsatilla is there, mercury is there, you call I say cinna is there, sepia is there, millifolium is also there. A lot of remedies are there. Villain Berito joined. Welcome. So it is already half an hour up, and I hope you like this YouTube live after a gap of one YouTube. I'll cover that in the coming week. So my dear friends, thank you for patient hearing, and I hope you enjoyed as much as I enjoyed sharing my knowledge with you. Thank you so much. Meet you on next Saturday for Insta and YouTube live.